y'all, this is Sabrina, your escape coach, coming in for another Health in Minutes on a Wednesday. So today I'm talking about something that's a little more serious, and it's about rest and visitation. You know, when someone passes away, the first thing we want to do is go by their house, and then we just come in numbers and we stay there forever and ever, and we don't go there. We may offer to clean dishes or do some tidying up in the house or bring some food by, but then we stay there and we reminisce and we talk. That's all good, but there's a such as overstaying your welcome. And a lot of times the people who are grieving are not in the mood of telling you that it's time to go, because they don't want to hurt your feelings, but then they're also grieving, so you got to be mindful of the time that you actually spend, when it's time to go, with your loved ones there. As far as the hospitals and nursing homes, there are staff there who are taking care of them. So of course it's a wonderful thing for you to come and visit your loved ones, bring gifts or flowers, spend some time with them, but you have to keep it brief, because that is a place for healing and transformation. It makes it kind of difficult for the nurses and doctors and other allied staff to do their jobs if you're in the way. So you have to limit your time to maybe 10 to 20 minutes max, and then leave. You can come back another day, or you can pray for them away from the bedside. You don't have to be in their presence to pray for them. Or you can pray, and prayer doesn't have to last 20 minutes either. So just kind of go and visit, take 10 to 20 minutes max, and then leave and allow some other people to come by and visit. Take time to just keep maybe two people minimum, at maximum, I'm sorry, two people maximum for visitation. You don't want to stay forever, and you don't want to have a crowd of people. A lot of times that raises the patient's blood pressures, or their heart rate may increase, and that's not good. I've worked in ICU for a long time, and to witness that, a lot of times the family members don't understand the effect that they have, either if you make the patient laugh, or if they're upset. Either or, there's an effect that happens on their heart rate, or their blood pressure. So you want to be mindful of things like that, and you can wish them well and come out. A lot of times the crowd that's there at the hospital, at the bedside, or a nursing home is not the same crowd when they're discharged. So be mindful of that as well. If you go in numbers when you think that they're going to die, or after they have passed away, are you actually there when they're living and when they're at home? So just think about it, okay? And be mindful of the time that is spent when you actually go to the hospitals and visit, or the nursing homes, or not clinics, or after someone has passed away. The family needs rest, and it's okay to stop by just for a little while, but then it's time to leave. Be careful not to overstay your welcome, okay? And this is Sabrina, your escape coach. I am signing out, okay? Have a blessed one.